Which of the following medications is most appropriate for the management of her symptoms? Alprazolam, duloxetine, hydroxychloroquine, methotrexate, or prednisone? A 38-year-old woman is diagnosed with fibromyalgia after presenting with widespread musculoskeletal pain, fatigue, and deep sleep disturbances. She has tried various over-the-counter pain relief medications without success. Which of the following medications is most appropriate for her symptoms? My gut is prednisone. Immediately. There is, for some reason, like, I don't think it's methotrexate because that's more for like rheumatoid arthritis. Hydroxychloroquine, I don't really even remember what that does. I don't think that has anything to do with this.
Okay.
Alprazolam is a benzo, and I don't think that's going to be helpful here. Duloxetine is an SSRI or SSRI or SNRI. And what I'm thinking right now, over-the-counter pain has without success. Duloxetine, there is something that, is it fibromyalgia? Or I do not remember if there's something that duloxetine and SSRIs can treat that starts with an F. And I don't know if it's fibromyalgia or something else, but okay.
Okay, what did your gut is prednisone. Do you want to keep it or you want to change it? So when you're in kind of these areas, right? So you did it perfectly. When I go through farm questions like this, I always try to classify in my head what the farm is, right? So
Yeah.
prazolam, right? That's going to be a benzo, duloxetine, SSRI, right? Hydroxychloroquine, that's going to be like your malaria drug and stuff like that. I'm pretty
Oh
sure.
yeah.
I don't think that helps us here, right? Methotrexate, like you said, that's like a rheumatoid arthritis. That's kind of your immune modulators, right? And then you got prednisone, which is a steroid.
Yeah.
So, um, so we have your gut answer choice, which is a steroid. So now the question is, do you want to keep it or change it?
I'll probably keep it.
All right. So actually it's going to be B. Okay. So the reason why I know it's B is this is kind of for a clinical standpoint, right? Which is why I'm pushing you to learn a little bit clinical. So fibromyalgia, do you know what this is associated with by any chance?
I don't.
So fibromyalgia, right? And when you start clinicals, you'll definitely see some of these patients, but a lot of them, the majority of them, will also have some kind of mental illness, like that's connected to anxiety or depression or things like that.
Oh, I didn't know that.
Okay, and I'm gonna say something, right? And this is just for the test. I'm not saying, in case, there's some people with fibromyalgia that are listening to me, right? But a lot of diseases or diagnoses that deal with pain that is unexplained, meaning that we don't have a how do I say this? We don't have a good explanation for it. That's practically what I'm saying. So fibromyalgia is one. Pelvic pain, right? Random, like for instance, even in the ENT world, we have unexplained neck pain, right? Or neck tenseness, right? All these things that have no physiological explanation. Okay, I'm just saying generally on a test taking standpoint. Okay, so I don't offend anyone that's listening to this that have these diagnoses, right? A lot of them, right, have very strong correlations with mental illnesses, right?
Mhm.
Usually these patients, right, the more anxious or the more depressed or the more sad they are, right, these will flare up these unexplained pains. Okay, so there is a psychiatric component to these diagnoses. So fibromyalgia is one of them, right? Like I said, unexplained pelvic pain, right? Abdominal pain, right? That is unexplained. What I mean is unexplained is like we don't have a pathophysiology explanation for it.
Okay.
Okay, so that's something you can take on a test taking standpoint, because if you try to look up, oh, what is the what is the pathophysiology of fibromyalgia? You'll Google it and they'll have all sorts of random theories, but nothing is concrete. They're like, pretty much they're trying to say, we don't know, right? They have
Yeah.
these pains, these fatigue, sleep disturbances, but you don't know what it is. And so one of the things too that I want to mention is what is it called? Irritable bowel syndrome,
Hmm.
IBS, right? Do you know what's the mechanism for irritable bowel syndrome?
I I'm not sure actually. I'm thinking more because this is like when you have chronic switching of constipation and then diarrhea. It's going back and forth. There's no like set, I guess you could say. Like you don't stuck in diarrhea, not stuck in constipation. That's kind of what I think about with IBS. I don't know
Yeah.
exact
So
mechanisms.
those are the symptoms, but on a pathophysiologic standpoint, the reason why you don't know the mechanism is because we don't know the mechanism, right?
Oh,
Yeah, exactly. That's what I'm trying to tell you, right? And so they've linked IBS also to, mental illnesses, right? Anxiety, depression. Those that flare up those kind of illnesses will also flare up their IBS. So just remember, right? These things that
yeah.
are unexplained mechanismally wise, they're usually associated with mental illness. And so, ironically, right, or unironically, it makes sense, right? If you treat, with an SSRI, which deals with, stability of depression and things like that, it also will help their fibromyalgia. It also help their IBS. It'll help these things that are linked to mental illness, right?
Wow, I did not know that. That's actually really cool.
Yeah. So that now in my other question to kind of take it a step further, do we know do we know why duloxetine helps with fibromyalgia? No. You know what
No.
I mean? Like we don't know exactly how it works, right? Because we don't even know how fibromyalgia happens, So, but we just know that it helps them. We just don't know what the mechanism of how that works, right? Like on a molecular level. So
Yeah.
it's kind of interesting, these things. So just I'm giving you overarching things so that you can use it for other diagnoses.
Yeah. Okay. Cool.